Hello, everyone. Welcome to today's webinar. I'm Barbara Scafidio, editor of Prevue, and I will be your moderator for the next hour or so. I am thrilled to welcome Amanda Schleede, CEO of Attend Safe. Prevue has worked with Amanda as our safety consultant from the point when we picked up our live events again after the pause. And she will be with us again in 2 weeks at our Me Well Summit in Orlando. I look forward to seeing her there, and we've got a lot cooking on the safety side for that, which we will share with you. Many thanks to today's sponsors, Royal Caribbean International and the Greater Miami CVB, for being part of this webinar on a topic that I know is top of mind for all of you, and certainly for me as well as the planner of Prevue Summits. Today's session will be recorded. You will receive a link via email, so don't worry if you miss something. And as with all Prevue webinars, you will receive CEUs from the Events Industry Council for participating. Please do jump in. This is a literal conversation between Amanda and myself, and we would love to be asking your questions as well. And be sure to download the white paper that Amanda created exclusively for this event. It's on your dashboard on duty of care. And that is it for the housekeeping. So I'm going to turn it over to Amanda to tell us a little bit about Attend Safe and her background, and then we'll just dig in. We've got some questions for you to take the pulse of the audience, and look forward to a great conversation. Amanda, welcome.
Well, thank you, Barbara, and welcome everybody who's joining us. I see the numbers slowly ticking up in the corner here. So as Barbara said, Amanda Schleede, I am CEO of Attend Safe. I have been involved in the COVID pandemic since the beginning, really focusing on how do we safely get individuals, human beings, back together and in person. And that could be in multiple situations, whether that's in-person events, which is where we're focused here today, schools, employers, all of that fun stuff. And so at Attend Safe, obviously this is not about selling you on Attend Safe, but giving you a little bit of my background. We focus on vaccine and test verifications for your attendees prior to either coming to the event or as a requirement of attending your event. And then we also focus on testing. So we look at pre, during, and post-event testing, and looking at how do we safely keep your attendees safe before they come to the event. And maybe that is you don't come because you're COVID positive, to once they're in person and interacting with each other, how do we keep them safe there? And then also, how do we keep them safe when they go back to their loved ones, which may be an unvaccinated child or spouse. And so we really are looking at how do we look at that whole picture of duty of care, and really looking at the health and safety requirements that you as an event planner, event manager, and even your clients, when you have all these people together, how do you safely bring them back? We are starting to work in monkeypox, which has been also really fun and exciting to see how this is going and where it is in the US and with the WHO. So happy to answer some high-level questions on that, not a ton, but would love to, open this up to have conversations about COVID and where people are thinking about COVID right now in their space. I think we have some survey questions for you guys, and would love to kick this off with the first one, which is, does your organization, or even if you're an event planner or event host, does your organization have a COVID policy for events? So if you want to take a few minutes or a few seconds and answer that, then we can kick this off.
Could answer that one.
All right. Barbara's got she's gonna have all the details for us.
Here are the results. Interesting. Awesome. Yes, 41%, no, 8%. And based on COVID protocols, 51%.
Wonderful. Okay. Great. I mean, that's a big thing. I always tell people that we work with and clients we work with, to be really focused on what are the state and local requirements, number one, and then what do the numbers look like in the area that you're either bringing people from or bringing people to.
Right. So why don't we just give a little background, Amanda, about how we have worked together on the Prevue Summits. It's a very different world from when we started doing our live events, I believe it was last May.
Yeah.
We did a in Dallas and have done several since then, and are looking at the Meet Well Summit August 17 to 19, Lake Nona Wave Hotel in Orlando. I can say that I was petrified when I did the first events, and we were heavily relying on vaccination.
Mm-hmm.
We've gone in a completely different direction for Orlando in August. We are really counting on testing, and you
Mm-hmm.
will be sending out test kits to all of our attendees, which they have to show proof of a test taken within 24 hours. So let's talk about that shift from vaccination to testing as being the standard.
Yeah. Yeah. I mean, I think what, I mean, obviously early in the pandemic, before pre-vaccination, we really focused on symptoms. We focused on, does anybody have any symptoms of COVID? So temperature, just not feeling well, sore throat. And we did a lot of, in the beginning, it was, how are you feeling? It was a daily symptom check. And then we did temperature checks. So I think that's really where we were to start. As we've seen COVID change, morph, get into other, strains and viruses, we have to do the same with our protocols on site. And so that's an ever changing thing that we're looking at as an organization and working with our clients. Obviously then vaccinations came out, people have gotten vaccinated. I would say a large majority, not all, but have gotten vaccinated. And really what we've seen as, the original COVID turned to Omicron or turned to Delta, turned to Omicron, and we've seen this morph. And every time somebody gets infected with the COVID virus, it does change. It changes slightly. And then you pass on to somebody else and it changes slightly. What we're seeing now is, vaccination is important from a health and safety standpoint. But it's not necessarily the only thing that you should be looking at when you're putting in-person events together. It's really, as you said, Barbara, the testing side of it. Because, I mean, President Biden, they just announced today he's COVID positive again. So after he went negative for, I think it was 5 or 7 days, he's now positive again. So he's a bounce back, COVID positivity individual. And I've seen many cases where we've had people who've been on site who said, I had COVID 3 months ago, 4 months ago, and they're still popping up positive. And so, there is a 90-day window once you become COVID positive where you'll likely still test for, positive for COVID. So it's always like I have this hesitation when clients say to me, well, they have to test negative before they can come. And it's like, well, if they finish their quarantine and say it's been 10 days or 15 days, the virus is not active and they should be able to attend because they're not going to get a negative COVID test. Some do, some don't. But really, as we've done with Meet Well, Barbara, that's coming up this month, is testing is key. So I really do tell all clients, if you're going to put money into anything, if you've got a very, defined budget to spend on this, spend it on testing. And that's, pre-testing, so you can identify those people who should not even get on the plane, should not get in the car, should not show up at the hotel, to, testing everybody is once they arrive, because then we look at it and see, there's been a 24 or 48 hour window since they tested, and now the virus may be more apt in their system. And so test everybody when they arrive, and depending on the length of the event, do testing throughout the event. So decide to do testing every 24 to 48 hours. We've had clients that we've had in CEOs who want everybody tested every morning between 5 a.m. and 9 a.m. and we test the entire group. And they, can't go into the day's events without a red bracelet on for the day, for Tuesday, or a blue bracelet for Thursday. Because it's two aspects of this. It's the testing side and making sure we're keeping people safe. The other thing that I think as a duty of care and like the health and safety side that we need to look at is you've got people who probably never in the last 2 years or close to 2 years have gone out and been with other people. So you're going to have a mix of individuals coming to your events. You're going to have people who as they lovingly say, are licking doorknobs, shaking hands and kissing babies, to the people who, are still having their groceries delivered and they're wearing a mask when they open the front door. So you're going to have this variety of individuals, and you need to kind of think about what that aspect and what that level of anxiety is. And so by having something visual like a bracelet that everybody sees, oh, everybody in this room has been tested in the last 24 hours or today, it does lower that anxiety. And I think the other thing that we've talked about many times, Barbara, is, masking. I mean, I haven't gotten the flu or been sick for 2 years. I mean, there's something to say about wearing a mask. Now, I know they're uncomfortable, they rub your ears, you got sores on your nose, all those kind of things. But I've really just become a standard mask wearer. And so I think it's really important as you're putting events together, having your standard hand sanitizer and having masks available for attendees, and also making sure that there's no mask shaming. I mean, I was at an event a couple weeks ago and people were walking around going, oh, why are you wearing a mask? Why are you wearing a mask? And I'm like, it's my choice. Like,
it's very different in different parts of the country. There are parts of this
oh
country where there is no COVID, and I'm from New England,
yeah,
and 10% of the people or 20 in a grocery store are still wearing masks here.
mm-hmm.
So and you're bringing people together. Plus, you're bringing your international people together.
Exactly.
So let me ask you, what would you recommend right now with BA5? And let's talk about that a little bit, which is I've been reading as measles. And it is interesting that everyone who hasn't gotten COVID seems to be getting this particular, version. How does masking fit in? Because I understand Comic-Con, for example, in San Diego, which has a very high positivity rate, that they did require masks. Mm-hmm. But I'm not finding a lot of other meetings that are requiring masks. Are meetings starting to highly recommend, or what's going on with the masking right now?
Yeah, so what I'm seeing is, number one, people are following whatever local and state requirements there are. So, that's kind of the number one thing you need to look at. Number two, I mean, and just to be blunt about this, the more alcohol involved in your event, the less likely people are going to wear masks. So just kind of keep that in the back of your mind. There have been some events that I walk into at the dinner, and I'm like, oh my goodness, there's a live band, people are dancing, screaming each other's faces, and I'm like, where are the masks? But I really think, from a standpoint of what we should be looking for masking is, really, as much as you can push it, and when people are indoors, have them wear masks. And it's just the idea of, it's a simple cough that you don't think is anything, that all of a sudden that cough spreads throughout the room, and now you've infected 2 or 3 people, and they may not have symptoms or show symptoms on site with that event, but they're going to go home to somebody, and they're going to have COVID. They're going to expose the rest of their family. They're going to figure out where they're going to stay for 5 days once they get home and find out they're COVID positive. So there's all these things that we can do to really be thoughtful of not only keeping the people in our actual event and showing up in person safe, but then when they go home. I think the biggest thing is having masks available, and having the right masks available. So, I mean, we've all seen the people walk around with the mask on their chin. I have a very nice, little thing. I walk up very smiley, and I'm like, oh my gosh, your chin is so protected, and then they kind of start. Your chin will not get COVID, but it's those little things. And I think, we in the beginning, I don't want to say that we were angry about it, but we were angry about having to wear masks. And I think it's just, if you present it of, we're looking to make sure that everybody stays healthy and safe. Plus, when you guys go home and all the attendees go home, your family can be healthy and safe.
Right.
Yeah.
So we are planning to have masks available at Meet Well and hand sanitizer. We also have spoken to the hotel about, as much as I love to do creative room sets, we are doing classroom with people 6 feet apart. And we have appointment sessions where our meeting planner guests meet with our supplier guests, and they are going to be 6 feet apart. Now, we'll have those tables if they choose to, move right next to each other, there's nothing we can do about it. But to me, due diligence is really on the planner, regardless. You can't change the activities of the people or the decisions, but you can create the proper setting, the safe setting. What are people doing? Are they still separating and doing spacing and queuing and all of what they were doing previously, or is that loosened up significantly?
I would say it's loosened up a little bit. I wouldn't say significantly. And it is, I mean, here's the thing, it's human nature. I mean, think about the fact that, when we go someplace as Americans, we just get in line. You know what I mean? Like, and we don't get in line 6 feet apart. I mean, that was the biggest thing when COVID first hit. I would walk and get in line, like even at the gas station and pay for gas. And I'd realize I was standing right behind the person in front of me. I had a mask on, all that, and I'd be like, oh, and I would take steps back. And so it was all about, changing our way of living and thinking, which we really, hadn't done, not to pick on Americans, but as Americans, we kind of get in line and we go. And so I think, there is a little bit of human nature. If you see somebody that at an event, and even though the event planner has planned it out, like you have, Barbara, where we have tables, people are 6 feet apart, the meeting tables will be 6 feet apart. But sometimes, it's just hard for people to hear other people. They have a tendency just to kind of want to conjugate together, and they move together. And I think it's just, as an event planner, to be mindful of that, and also have a really good way of reminding people of why we set up the room the way we did, and so it's just having those kind of conversations of like, hey, I understand you want to be closer, but could we move these, chairs so you're not sitting exactly next to each other? But I will be honest, I think the overall flow and kind of control, we do COVID pandemic response consulting as well, and working with event planners and clients to think about, how do we set up rooms? If it's a room that can hold 100 people, are we going to put 100 people in that room? Well, obviously no. But how are we going to set it up so that we do have the social distance spacing for those people who want it? Because again, you're going to have people who are going to want that space between you and the next person. And there's going to be people who want to sit in a group, and regardless of how you set up the chairs, they're going to move them. A perfect example, 3 weeks ago, we did a testing of everybody in an event. And we had, room where you came in and got tested, a room where you waited. We're of course doing the testing, and I walk into the room where we have people waiting, and they've moved all of the chairs into a circle. And they're sitting in a circle, and I was like, okay. I was like, so we're gonna need to move the chairs back. And everybody kind of looked at me like, why? They were set up this way on purpose, because I don't know if you're COVID positive or you are, or if everybody's negative, so but it's just that human nature of like, oh my gosh, I'm seeing people for the first time and I want to meet, and there's, it's I even had somebody who said to me, I don't feel that great, can I get tested? I was like, sure, let me walk you to the testing room. And as we're walking to the testing room, he stops, shakes hand, and gives a hug and a kiss on the cheek to this woman. And I'm like, I had this moment where I was like, and I looked at her name tag so I would know who she was. We got to the testing room and he was COVID positive. And I was like, okay, now I got to go find this woman. You know what I mean? So it's those simple little things we don't think about, but like, we're watching it like, okay, wait, you can't kiss and hug somebody that you think you're sick,
Right. I think having the testing on site is so important.
Yeah.
Tell me about situations, I'm sure you've had them, where you've had people test positive in the middle of a meeting. How have you managed that, and how have you worked? I know every hotel has its own policy. Typically, you connect with the is it security beforehand?
Security or the COVID security. Sometimes most hotels have an identified individual who's responsible.
And they inform you about the policies of that hotel and the protocols. So and you take all of that on when you are working for a company like me, correct?
Yeah, correct. So we, we work with the venue, and you could be, at a hotel and a convention center. So we may have two completely different policies. But we look at what are those policies and procedures on site. And really, as part of what we do as a service, is I lovingly say we're COVID risk mitigation in a box. So you as an event planner, Barbara, can focus on the event, making sure the right people are at the right place at the right time, mic'd, right slides, all that stuff. We are then managing the COVID aspect of it for you. So if somebody, if Amanda walks in and she doesn't feel good and she's tested and, I'm COVID positive, we have a plan that we've already set up with the hotel or the venue as to how we're going to manage that COVID positive individual. And we've seen all gamuts of COVID protocols on site. I think it was in December, January of this year, if you were in Las Vegas and you tested positive for COVID, you had 20 minutes to get out of the hotel and you got a lovely free ride in an ambulance to the COVID hotel 15 miles off the strip. So we had to know what that plan was and how do we get people, packed safely out of the hotel to that lovely free ambulance ride. Two, we've had hotels that are like, hey, just let us know. We're going to still deliver food and linens to the room, but we'll go to the front door and knock. So it really just depends on, what that organization has. And we work with each of those venues to know what those are. Because in our eyes, we want to plan for worst case scenario and then hope for the best case scenario, not the other way around.
I have to tell you, the questions are building up. However,
okay.
More polls. Do you want to do a couple more?
Sure. Yeah. Why don't how about this other poll for you guys? How are you comfortable with attending in-person events right now with the where COVID is? I'll give a couple seconds.
I'll let you know when I see the results.
Okay. I mean, the other thing, do you want me to kind of talk a couple data points about COVID right now while we're waiting on the poll?
I can answer yes. It's very different from how it was a year ago. And 55% of our audience agrees with yes.
Yeah.
I have 9% that say no. And yes, I completely agree. We have 26% who say it depends on their COVID protocols. So they're effectively choosing the events they're attending, which is a huge association event.
Yeah, and really what I say to everybody when we start working with clients is the sooner you make a decision and the sooner you have your COVID protocols, and hopefully you're doing it before people start to register, communicate those. Communicate out what the COVID protocols are. Because number one, you're going to get people who are hemming and hawing whether they should attend. They will make a decision to attend based on your COVID protocols. They may even also need to get an employer approval to attend. So it's good to have the aspects and be able to lay it out. But to let people know that you actually have made a plan and that you're going to do something. Because not to be, as I always lovingly say to Barbara, not to be negative Nancy about COVID, but if you look at the numbers, I pulled data just on August 2nd because that was the most recent data that was out. In 2021, we had 102,000 cases of COVID. Right now, we're at over 160,000 cases of COVID, same time this year. And that doesn't include at-home test kits. So what's very interesting is, as we know, the government, and everybody's testing at home now. And I had a friend who didn't feel well, got a home test, tested herself, and called the Chicago Health Department and was like, I want to report my test. And they're like, thanks for letting us know, but we're not recording that. So it's amazing. So if we're at 160,000 plus tests or positive cases now, what are we really at?
Very high. And it sounds like wastewater is becoming the only way that we know what's going on,
So what's really interesting about the wastewater testing is it's a month behind. So the testing we're getting now, in August is really the June testing. So, it's like there's that 30-day lag of, what's really going on.
We're finding out it's much more prevalent than, the numbers. This is a terrific question from Deidre, and I was facing that with meetings in Florida. What do you do if you are not allowed to ask for vaccination status or required testing? Now, as I understand it, Florida is it's only vaccination status that is not allowed. But why don't you tell us what it is?
So number one, so the state of Florida stuff, my understanding is that it had to do with employers or schools requiring so that are Florida based. If you are a private organization so we'll use, Prevue as in the Meatwell event, that is having an event in Florida, you can mandate your event requirements. So as Barbara said, we're asking for vaccination information if people are willing to provide it at Meatwell, because I think it's a good data point to have. But then we are requiring everybody to test prior to departure and coming to Meatwell, and we'll also have testing available on site. And so really what you need to do is with your clients and who you're working with, and I say this all the time, it is a leadership down decision. If you have leaders who are not going to follow the rules, skirt the rules, be the special VIPs that don't have to do that, then you're going to have an issue, at your event. But really, you got to get leadership and board approval and say, everybody needs to be tested to attend, or we're going to test everybody every 48 or 72 hours, and make that a requirement of your attendance, and make sure that everybody knows it's a requirement. And you are going to have, I lovingly say, a special snowflake or 10 or 100, depending on the size of your event, that's going to say, I don't want to do this. And you have to make the decision with your leadership team to be okay with saying, then you can't attend. Because you get that one person, and it really just takes one person who doesn't, get in line, follow the rules, who could be COVID positive, who then comes in and makes your event a super spreader.
Right. But the thing that seems to have changed, and this is another question a few people are asking, is that most organizations are not following up to even see who tested positive, and most people are not reporting that they did. So the whole idea of contact tracing, which is something we started after COVID doing with you, and people actually wore these devices, is that just completely gone away?
Yeah, I mean, we still have it as a service. I'll be honest, we've had very few people who've been interested in doing it, because I think, because
exactly that you do. This is not really contact tracing.
Yeah, no, it's really, yeah. So what it is actually a Bluetooth wearable device. The device itself has no GPS capabilities. It is about the size of an Apple Watch face, and it gets attached to your badging. So prior to people attending, we attach those to your badge. They are, as I said, Bluetooth devices, and what they do is they ping off of each other. So again, no GPS. They know they're on, on the planet Earth. They don't know if they're in the state of Florida or the state of Illinois. And what they do is they record interactions between other devices. So if Barbara and I were in a room together right now, and I had device number 1 on and she had device number 2 on, it would be recording that we were together for 47 minutes and 12 seconds on August 4th at 4 feet. And so what happens is then, if I become COVID positive tomorrow, we can go back and look at, all the interactions that device number 1 has had over a specific time frame of dates. And then we look for any interactions of 6 feet or less for 15 minutes or more of cumulative time. Because it's not the, sitting down for 35 minutes and then be done. It's the 35 minutes and then the 10 minutes and then the 5 minutes. So it's all those interactions together. And then we can identify those people that we need to, do additional COVID risk mitigation, which, is testing, mandating that they wear a mask, doing daily testing on them, that type of thing. And so, we've really seen that people or clients have moved away from that, and really what they're doing, and quite honestly, I can say testing is key, but really is putting more of the money and the effort into the testing and having the on-site testing, and really that full, as I say, VIP experience for your attendees. Because you're not going to get any, it's like I talk about monkeypox now, but you're not going to get any attendee who's going to come up to you, Barbara, and say, I'm really not feeling good. I'm going to go to the Walgreens down the street. But if you got a testing room and the person can just literally walk in the door and say, hey, I woke up this morning with a sore throat. Could we just get a quick COVID test? And then if they're positive or negative, we obviously implement those protocols. That's a lot easier, and people are more apt and open to doing that type of, just COVID risk mitigation on themselves and all the other people in attendance. You know, and I'll kind of jump into monkeypox a little bit. You know, people have said, you know, how are you going to manage monkeypox? I mean, it is an issue. I mean, we have over, I think, 6,600 cases identified in the US. The United States is the largest country with the largest number of cases. You know, right now it's body fluids, you know, close physical contact, you know, swapping of spit, as my dad would say. You know, so the thing that becomes interesting though is it's usually a rash, or some, you know, high fever, body aches, that type of thing that you're going to get from it. I'm leery about where we go with monkeypox and how we do that for on-site, because I don't know if we're going to have an attendee who's going to walk in and be like, hey, could you look at this rash on my inner leg and let me know what it is? I mean, they might, but, you know, we'll see. You know, but I think that, I mean, that's another thing that we just need to keep our eyes on from an event standpoint is, you know, how are we going to manage that aspect if we do have, you know, an attendee who, you know, shows signs of monkeypox. So I think, you know, we're in a new world. I mean, you know, 2.5 years ago, our world changed. You know, will we ever go back to the same normal we've had in, you know, 2018? I don't know. I mean, my gut says no. And I think we're going to always have something else coming behind COVID, something else coming behind monkeypox. And we're just, what we need to do is keep ourselves educated and knowledgeable about what's going on. And then how do we be responsible to our attendees on site and keep them healthy and safe?
Right. Did you want to do another poll?
Yeah. I guess, well, I kind of gave this poll away though, Barbara. My question was, did you know that the daily cases are higher now than compared to last year? So we got to skip that question because everybody's going to say yes. I'm going to get 100% response. I guess, you know, we kind of talked about masks earlier, but, you know, do you still wear a mask at indoor events? You know, see what the attendees say about that. I mean, I know I do. I usually get the looks.
Yeah,
You know,
okay. Let's see what they say. I'm guessing it's much more heavily skewed toward no, but we will see.
I will say that my favorite, you know, the wearing it on the chin or wearing it around your wrist.
Yeah, okay. It's 60% no, 40%
Yeah.
yes. Okay.
Yeah.
Very interesting.
Do you want to do another quick poll? Because I think this is a fun one, and I always talk about this as well. But you know, like, you know, as a audience, are you sick of COVID? You know, and are you right now just in COVID fatigue? Like, you don't want to hear about it anymore. You don't want to deal about it anymore. And you just kind of, I mean, we all want it to just go away, you know, but
I would say heavily sick.
yeah, I would say heavily this is going to be a yes, but you know, I don't want to sway anybody. Oh yes.
Do you see the results? 88% are in COVID fatigue. So
Yeah, I mean, we are
in the country, which could skew it because everyone here has had to really change their jobs, their roles, their responsibilities because of COVID so heavily. And meetings obviously are just, I don't want to call them a breeding ground. They're not, but you know, we're in a business where COVID could spread. I mean, just like any public business where people are facing each other. I have a great question here from Connie. Thank you, Connie. How do you get hotels to support what your organization needs them to do regarding a healthy meeting environment? I always ask hotels that everyone who works on our event mask. I never get any kind of pushback. They are willing to do the buffets where they serve and so forth, but can't. That's just your workers, you know, your team working on your event. So what do you do with venues?
Those situations. So I think number one, when you're starting in the contracting phase of it, you need to bring it up then. You need to say that, you know, you're working with a client or your client, or we want those individuals who will be, you know, interacting with our attendees to follow our COVID protocols. Now, you're going to find some hotels where it's not an issue. You know, I would assume, Barbara, it's not an issue for Meetwell. You know, if you get into larger hotels like in Las Vegas or Chicago, where you're a heavy union situation, you're likely to get pushback if, you know, if say you require everybody to be tested and wear a mask, you know, you're likely to get pushback from the hotel to say, hey, we can't force our unionized workers to do X, Y, or Z. So just keep that in mind. But I think, you know, really what you want to do is have those conversations early. You know, I mean, we've had clients who've waited till a week or two beforehand and say, hey, we want everybody serving food to wear a mask. And all of a sudden the hotel's scrambling to figure that process out. So again, it's just like with your attendees, it's early communication with your venues. It's setting up what your protocols are going to be early on. I mean, we're working with people right now that we're looking at January through March of 23. You know, and they're scheduling their events now and they want to establish their COVID protocols, which I think is great. You know, they keep saying to me, like, I feel like this is so, you know, too far in advance. I'm like, no, like set them up now, make it part of your contract and agreement with the on-site venue and hotel. You know, you know, Barbara, I've seen what you've done with Meetwell and other events with Prevue, and it's been awesome. I mean, it's grab and go lunches or grab and go, you know, back to your room with a little bottle of wine type thing, or sit outside, you know, socially distance, or even just outside on a picnic table or a table and relax and chat with people. And that's been awesome. You know, what makes me cringe is when I go and buffets are back. You know, like when full buffets are back. And I think to myself, okay, well, I'm eating someplace else tonight. But, you know, I mean, people just don't think about, I mean, I don't want to say we live in a dirty world, but people just don't think about what they've touched. Now, you know, now they've coughed in their hand, they've sneezed in their hand, they haven't hand sanitized. We've all grabbed the same spoon to, you know, scoop out potato salad, you know, any of that kind of stuff. And it's even the simple things like, and one of the big things when we do COVID response consulting with a client and talk about how we're going to serve food, you know, if you've got stations and you're handing your already used plate to somebody else to put more food on, you've now touched that entire rim of the plate. You've got the person at the hotel with a glove on grabbing that plate. You know, now they get whatever they get on their glove and now they're passing it to the next plate. So really, if you're going to do kind of a buffet line, it's almost like the plate gets passed with the workers from the hotel on the back and they just kind of put what you want on it would be the ideal situation. And then you pick it up at the end. So it's like, you know, it's a one touch type thing.
Yeah, I think we were much more cautious with those instructions at the beginning, and it's all faded away. But they are still those are risky behaviors.
Yeah.
Another great question.
Yeah.
And I think we're done with our polls, correct?
Yeah, I mean, we have one more poll, which is, you know, how have clients been asking you to manage on-site COVID, you know, risk mitigation, you know, including like reviewing vaccine and test results, you know, how managing positive cases. So, I mean, that's, I think the last question we had to ask. So
that ties in very nicely with a question from the audience. So if we
great.
could run the poll. Have clients asked you to manage on-site COVID risk mitigation to include reviewing vaccination cards, test results, etc.? So this is for the people on the call versus I would have you doing all that.
Exactly.
So how many of our, okay, that's interesting. So 67% of our audience has not had to do that level of detail around risk mitigation, perhaps because they have hired companies to take care of it.
Yeah.
And then
Perhaps they're a 10 safe client.
But those 33%, that's a lot of extra work and responsibility compared to, you know, what they were doing pre-COVID, and it falls on us.
Yeah. And the other thing you know, the other thing I hesitate, sorry to talk over you, Barbara, is, you know that vaccination cards and test results are PHI data. It's personal data. And so, you know, if you as an event planner are getting vaccination cards emailed to you in your Gmail account, that is actually a HIPAA violation. It's PHI data, it's personal health information. And so really you should be saying, you know, I don't want that liability, whether it's me personally or the organization. You know, there's people out there who do this. You know, we have competitors who do it. We're not the only people out here. But you know, you need to think about what is the liability, as an event organizer, as an event host, as an organization, to be taking on and holding that information and having that data.
Very interesting. This is the question I was going to ask. In terms of liability, what are event organizers' best practices? I know we do a waiver that we have everyone sign, and they can't participate in the meeting without signing that waiver. But what are companies doing out there?
So, yeah, I mean, a lot of companies are doing waivers like Prevue and Meetwell is doing, and you guys have done for the last, year and a half. It's usually a waiver that just says, I'm taking the full responsibility of attending this event. And if I get exposed to COVID, then I'm going to deal with it. I will say though, that depending on the state, as we know, California, I always tell everybody, like, build everything for California. As if you worked in the state of California, because they seem to have the most restrictive, employee and individual laws. But if your event, depending on where it is internationally or in the US, you need to know what those laws are and do those waivers actually cover you. Because there are states and locations, entities that you can have them sign their life away or their firstborn, but when it comes down to the brass tacks, they can still sue you if they get COVID, or God forbid somebody gets COVID and dies as a result of being at your event because they were exposed by others. There's many lawsuits in the courts right now of early individuals who were in manufacturing jobs that were exposed because they felt they were essential workers, which they were. I mean, we all know we need food. And they had individuals who were unvaccinated because there were no vaccinations at the time, and they kept working and they contracted COVID and died. And so their estates and families are now suing those organizations and companies. So I think what I say to everybody is do something. We've had clients who called us and said, what is the bare minimum that I look like I'm doing something, and we lay that out for them. There's other clients who say, our CEO or our leadership team wants to do everything possible. So, we're likely still going to have a COVID, positive individual at the event. I'm not going to say a COVID outbreak, but we might have a positive individual at the event. But we definitely want to make sure that we're doing everything we can to make sure that we're keeping our attendees safe. And that's really what you need to be focusing on is, I know everybody's got a budget. I know likely this was not part of the budget planning when you decided to have this event. And maybe this is an event that you originally were going to hold in 2020 or 2021 that's been pushed to 2022 or beyond. And so, you really need to look at what are the things that we need to do to keep those individuals safe and show that we are actually, worried about their health and safety and, covering as an event planner, as a client, that duty of care.
Okay. This is interesting, and we really need to think about it moving forward. Yep. There is a segment of the population that is at risk, and they still want to attend these meetings. Mm-hmm. And we need to be very cognizant of accommodating them. Yes. So this person mentioned, that how can they stay safe during dining functions? Because they need to mask at the event, but they need to eat. So mm-hmm. Is that something people should be including in their, special requirements? Should you always have food, speak to the property about meals to go? Should you set aside single tables or tables for two? I mean, how can you help people who want to be a part of the event, but they can't sit at a table with 8 people? Eat.
Yeah, I mean, I think all those points are great, Barbara. I think, again, this is a communication thing. And when you're sending out for your registration, have a simple line that says, would you like us to talk to you about additional COVID risk mitigation, policies or procedures for you individually on site? And it is looking at things like, if you have a 10-person round table, do you really sit 10 people there, or do you sit 6 people there? If you have individuals who, are at risk, could not get vaccinated for some type of health reason, and are still at risk, but obviously you need to feed them, they could easily in those conversations, be able to say, hey, I'd really love it if I had a grab and go lunch or dinner that I could take up and go eat in my room by myself. So I can remove my mask. Or you could say, we're going to have, outside eating reserved. I wouldn't put like, this is Amanda's table, but I would have a reserved sign, to indicate and just have the side conversation with that person. Be like, Barbara, totally understand your situation. We have set aside a table outside under the awning for you for lunch and for dinner. Or we will meet you in front of conference room B with your meal, or we'll have it delivered to your room. What time works for you? Is it between 6 and 6:30, 6:30 or 7? And I think all those little touches really make your attendees feel like you're, number one, paying attention to their needs and their health needs, but number two, really creating that whole VIP experience. Because they've paid money to come to this event or not, depending on your event. But they're in the back of their mind, they're spinning about, okay, I'm unvaccinated, I can't shake hands, and the other thing I've seen people do is the green, yellow, and red buttons, like, red button is like stay away, I don't even fist bump, yellow is I'll fist bump or handshake, and green is like, hug and kiss me. Those are great, but I'll be honest, people don't pay attention to them.
No, we did it.
Yeah.
They were taking them off.
Yeah, and if I'm the person with the red, red lanyard on, I'm like it's uncomfortable to be like, okay, Barbara, like, please, so I think it's just, helping in any way that you can to make your attendees feel comfortable, and, providing them with any, I don't want to say an out, but any outs that they have where they can still eat but not have to do it in the group. And you could also set up tables if, you got tables of 10 and you're setting up for 6 or 8, maybe you set a couple of them up with just 2 or 3 chairs, and not make it so obvious.
And to have different levels of comfort accommodated. I think that's very smart.
Yeah.
Tables of, because I'm sure this person has a friend that they would love to eat with, rather than go to the room or whatever. Great. Thank you, everybody. Your questions are incredible. I don't think we're going to be able to get to them all, but I will send them to Amanda and hope she's can reach out independently and answer them. This is a great question, and we're certainly finding it to be the case. Does testing really work? So this person had a 200-person event. Everyone had to be vaxxed and tested within 24 hours, show a negative test, and 10 plus people tested positive. So I guess my question is, I'm sure that was antigen. Are companies or organizations using PCR? It is more effective. Are most using antigen and just dealing with the fact that, especially with BA.5, you don't test positive immediately? What's going on with testing?
Yeah, so I think, it's hard because I can't actually ask that person, like, hey, what kind of tests did you do and when did you do them?
That information, they can type it in right now, and I'll
unmute that attendee. Unmute that attendee. No. So here's a couple things. At-home test kits are less effective than clinically administered rapid tests. Okay, so if you're going from like bottom to top, it's going to be at-home tests, it's going to be clinically administered rapid antigen tests, and then it's going to be PCR tests. And so, I think you have to do something before people even get, that, like you said, the 24 hours prior, before they even think about, leaving their house with their bag packed. They need to test and they need to report that in. The other thing is, we would love to say society is going to have the honor system and everybody is going to say, I just don't feel good, I'm not going to come, but it doesn't happen. You know what I mean? So you need to have some type of a way for people to report in their tests and to get those verified and for them to get the green light to, leave their home and go to the airport. So that's number one.
It was PCR, by the way.
It was, yeah. So the other thing is, really focusing on the clinical level testing. What's interesting about the newest variants is, and we've seen this even on site, is we will test somebody who comes in and says, hey, I have a sore throat and, or stuffy nose. And I think it's just because I'm in a different climate than I'm normally in. Yeah, we'll test them and they're negative. And then we say to them, we want you to come back tomorrow morning. Our ask is that here's an N95 mask. We ask that you wear this mask. And we never get pushback, because it's like, we want you to stay safe and we want the other attendees to stay safe. And we will hand them a mask and say, you need more of these, please come back and get them. And then they come back and test the next day and they're positive. And then they're like, but I was negative yesterday. And the explanation that you have to understand is the antibodies and the COVID virus itself has to build up so much in your system for it to actually be, detectable by the tests. So, it's not a perfect system. I'm not going to say that it is. Is it more perfect than just putting your hands up and saying, I just hope to God nothing happens? Definitely. Because once you do identify that person, you want to make sure that they are getting everything they need from, a health standpoint. So fluids, any medication they may need. If they need to go to the hospital, they're going to the hospital. They're getting the care that they need, and that they're not interacting and exposing other attendees or even other people just staying at the hotel or the venue. And then, if we can, how can we safely get them home? So if they drove there, are they well enough to get in their car and drive themselves home? Do they need to rent a car to drive home? From a duty of care standpoint, I say this to my clients all the time, we should not be letting people leave and get on a plane and fly home. But can we handcuff the person to the bedpost? No. Do you know what I mean? So, it's one of those, it's a mix of, how much your attendees, and some of the times those attendees are your employees, understand what the rules and regulations are once they are COVID positive on site, and are they going to follow them? So I think, circling back to testing, Barbara, I think, clinically administered tests are the route to go if you're going to have a pre-testing. And then I think just being on site, having those rapid antigen clinically administered tests, so that we make sure that people are getting the right sample. You'd be amazed at the people who just stick it at the top of or the bottom of their nose. They're like, okay, here you go. I've even had people who've spit on the nasal ones. They're like, here. I'm like, no, this is not how it works. You know what I mean? So, having that available. And I think the other thing is, PCR testing is a lot more available than it was early on in the pandemic, even early on in this year. Yeah, and so we actually have the ability to do on-site PCR testing now. Yeah, so it's actually what's called isothermal molecular testing. So it is nicknamed the rapid PCR test, but it is a 30-minute test. And it does qualify for all international travel. So if you still have people coming internationally, they don't have to test to get in the US, but they may be required to test to get home. And depending on where you are location-wise, it may or may not be easy to get that test to go home.
I have some good advice from from Jill. Check and see if the hotel would extend their reservations at the group rate for those people who do fall ill. And these are all the extra steps that we need to be taking ahead of time and anticipatory that people will test on site or follow on site. We probably are at our time to wrap this up. I don't want to wrap it up with a negative way, but there have been questions about monkeypox. It is all over the news. It is horrifying to see the photos, and we are going to have to, it's being declared, I believe, a health emergency in the US or by the WHO. Whatever, if you could share what the status is, but it's growing quickly. Should we be putting it on the front burner with companies like you? Are there questions we should be asking? Where are we going with this?
Yeah, monkeypox is interesting as we're watching it. As I said early on, the US right now has the largest number of positive monkeypox cases. I have my little statistics paper down here, but the US is currently at 6,616 cases, and we're a country that has historically not reported ever having monkeypox cases. So that's pretty huge. I mean, the next country in line is Spain with 4,577 cases. I think the thing that is going to be a little bit more difficult for event planners is, from what we know now about monkeypox, it is spread through direct skin-to-skin contact. You know, I also fear, you know, and not that I mean, I hate that this is being recorded, but I love this is being recorded. You know, the large majority of the cases they're now finding is in the gay male population. And my fear is that this is somehow going to become like the new AIDS epidemic. And it's not, because it may be found now there, but we all know what happens when some of our attendees are away from their spouses and there's a little bit too much alcohol involved. You know, so things get out of control and we don't want to know. And so I think, you know, I think the thing is we need to keep our eye on what's going on with monkeypox. The difficulty of it now is, right now we don't have access to vaccinations, you know, globally. I mean, they're starting to pump them out, but, you know, unless you right now have a special connection or case, you know, you're not going to be able to get the vaccination. It's not like you can go in and get a flu vaccination. And so I think we need to keep our eye on it and figure out what we're going to be doing with regard to testing and managing that moving forward.
And we so appreciate your wisdom, and I truly appreciate working with you at our events. So I'm going to leave it there. Thank you, everyone, for being a part of today's webinar. Amanda, thank you so much for being there. Many thanks to Caribbean International and the Greater Miami CVB for sponsoring this event. And have a wonderful rest of your day, everyone. Thank you.